Are there solutions for ethical issues in live virtual care? Imagine being able to see your doctor from your living room and feeling confident that your privacy and safety are protected. That's what live virtual care aims to do. But with this convenience come some important questions about ethics. How do we make sure patient information stays private? How do we keep the care safe and high quality? And how do we make sure everyone has fair access? These are big questions, but solutions are out there. One key solution is using secure, encrypted telemedicine platforms. These platforms protect sensitive health data from being accessed by unauthorized people. Patients should also have private spaces for their virtual visits, especially for mental health therapy, where confidentiality is vital. Providers need training on how to set up their equipment properly to prevent accidental breaches. Following legal standards like the Health Insurance Portability and Accountability Act helps ensure data stays safe. Another important part is informed consent. Patients need to know what to expect from virtual visits, including potential risks like technical failures or limits in physical exams. Clear explanations about how their data will be used and shared are essential. Patients should be able to choose between virtual and in-person visits based on their comfort and medical needs. Respecting their choices is part of ethical care. Ensuring quality and safety is also critical. Providers should follow specific guidelines for telehealth, knowing when virtual care works and when in-person visits are necessary. Remote patient monitoring tools can help gather vital signs and other health data to support virtual assessments. Providers need training on best practices so they can recognize when a patient needs to be seen in person. Patients should prepare for virtual visits by finding a quiet, distraction-free space to get the most accurate assessment. Maintaining professional boundaries is another way to address ethics. Providers should communicate clearly about their availability and response times. They need to be licensed in the patient's location to avoid jurisdiction issues. Transparency builds trust and keeps the relationship professional. Equity is also a big part of ethical telehealth. Platforms should be easy to use for everyone, including people with disabilities or limited digital skills. Support should be available for those without reliable internet or devices. Telehealth should not become a lower standard of care for underserved populations. Professional organizations develop guidelines that focus on core principles like autonomy, doing good, avoiding harm, and fairness. These frameworks help providers navigate ethical challenges as technology evolves. Regular review and research help keep these standards current. Setting up ethical telehealth appointments involves informing patients about privacy measures, obtaining consent, verifying their identity and location, and ensuring the platform is secure. Clear instructions on how to prepare for the visit are helpful. Providers should document each session carefully, noting any limitations or issues. In the end, solving ethical issues in live virtual care requires a mix of secure technology, honest communication, professional standards, and thoughtful planning. These steps help protect patient privacy, ensure safe and high-quality care, and promote fair access for everyone. By focusing on these solutions, telehealth can continue to grow as a safe, reliable way to connect patients and providers.